One of the problems with not seeing the big picture or considering the big picture when we're taking care of a child or an adult for that matter is the trap of excessive testing. You know, it seems like in medicine we should intuitively do a test, get an answer, and move on. But it doesn't work that way in medicine. We have many tests that may either mislead us or not give us any rightful answers to begin with. A perfect example, which hits really home with me, is my now teenager's 3-year experience. So when he was 3 years old, and unfortunately I was far away at work, he started having cough and difficulty breathing and wheezing. So my wife took him justifiably to the local emergency department, and she tells me, and it still hurts me inside, they pinned him down to swab his nose to get a really good sample so they can test and see what was that darn virus that caused these symptoms. All they had to ask was, tell me about your family history, tell me about your health experiences before, and they would have realized that this is a case of reactive airways, maybe triggered by the virus they caught, but the virus was not the main instigator. It was just a spark. It was the individual's reactive airways that made the symptoms. The treatment is completely independent of that darn virus. If anything else, the same child is prone to anxiety, and you've now furthered their anxiety. You added to distress. You've made things worse rather than better. Now, it gets even worse, unfortunately, because if the first 3 tests we do, RSV and flu and COVID, which are the standards now, don't reveal the pathogen, we do more. Let's go down the 20 list. And after a while, and I've had families tell me this, I had a mystery virus. It's not a mystery virus. Your body reacted to a virus in a completely different way. Another context where this happens a lot is strep testing. I've heard many families say to me, every time my child gets sick, they have strep. If their stomach hurts, they have strep. If they're vomiting, they have strep. If they catch a cold, they have strep. One thing that, I'm not saying strep doesn't happen, it does. Strep throat happens a lot, but not every child who has a positive strep test has a strep throat infection. There are many individuals who have what we call strep carrier. Remember, we have 10 times more microorganisms in our body than we have human cells. If I swab my skin and I send that sample to the lab, they're going to find bacteria. It doesn't mean I have a skin infection, but the bacteria was found. Finding the bacteria and having an infection are 2 separate discussions. And in some individuals, the more we swab and the more frequently we find strep, does not necessarily mean that strep was causing the problem. Strep was discovered, but maybe they're strep carriers. And it's misleading us, misidentifying the pathogen. Maybe they're coming down with a completely different illness, and we're attributing it to strep and giving them more antibiotics and maybe causing more harm than good. Another very common scenario is digestive issues in kids and young adults. It's very common for kids and adults prone to higher inflammation to show the symptoms in their GI, gastrointestinal tract. It happens all the time. Recurrent belly pain, digestive issues, recurrent vomiting, you name it, all these symptoms can happen. So justifiably as a parent, we want to get an answer. So where's the answer come from? Scope from above, scope from below, take a biopsy. Imagine the distress on the child, the dangers of the circumstances of getting those testing done, all to what point? To say, yes, indeed, you have inflammation of your GI tract. Do they sometimes find something mysterious? Yes, they do. But the vast majority of the time, it goes back to you're prone to higher inflammation, and yes, indeed, we found it in your GI tract. Now let's talk about how to reduce inflammation. Do we really need to do a scope every time? Or can we ask some key critical questions and get right to the root of the problem?